This is the Don't Hide the Scars podcast, presented by Pain, Parents and Addicts in Need. Stigma and addiction recovery, what you need to know. I'm Jason LaChance, and I'm here with the founder of Pain, Mr. Flindt Andersen. How are we, good sir?
I'm good, Jason. How are you doing?
Doing well, doing well. You know, I've been noticing that there has been more of a shift, but not where we'd like it around stigma and addiction and recovery. So wanted to dig in with you today and just jump into a variety of questions around it. From your perspective, what's one thing you hear a lot about in, recovery circles or outside of them about stigma? But what does it really look like, for the person that comes and asks us at Pain for help or the family that's seeking help?
Well, I think one of the stigmas that is out there is the fact that most people, they still have a thing about the homeless addict and the non-homeless addict. And those are two different scenarios. They just are. The addiction's the same. But again, not every homeless person wants help. Most of the non-homeless people do, in my opinion. And I think the majority of the, quote, bad stigma of, oh my God, they're just a drug addict, I think is starting to wane to some degree. I think it's still there. I just think we have to put more emphasis on treatment than on trying to get the stigma reduced, because I think the stigma, whatever it is, small, large, in between, it's going to remain the same.
Yeah, well, we got to continue to do the work because there are so many stereotypes out there about people with addiction and misconceptions. We've talked a lot about, like you said, it's the homeless person on the streets, that's the addict, when no, we've seen it. It's the kid in the good neighborhood where his parents are hardworking, but, gets caught up for some reason. But from your perspective, what are some of the biggest myths that really need to be challenged to continue to break stigma?
Well, again, I mean, look, I think this all boils down to one thing. I think people are looking for answers, and I think they're looking for solutions. And the fact that in the past, those advocates and other folks have not really told the truth about addiction. I think that they haven't given answers. They have just tried to say, why don't you take this? Let's keep it long term. Let's do the long term harm reduction. So let's make sure we keep you on something because we just want to keep you alive. Again, at that point, I think that person is still an addict. Is still a practicing addict, to be honest with you. But again, I just think there's not enough of advocates out there talking about the solution. And the solution isn't the we're going to cure addiction, because we're not going to cure addiction. Addiction is a non-curable disease. It is a manageable disease. It is a manageable topic, so to speak. We just have to do it the right way. And there's some new things coming up that are absolutely going to change that and help us do it.
Absolutely. Yeah. And we talked a lot about, I think, two of those factors that don't lead an individual or a family towards wanting to get an individual help of shame and guilt. And how have you seen that not only play out for yourself in your life, and I don't mind dropping in how it's played out for me too, but how do you address it with working with newcomers coming in, or the support meetings with the families that you've done for over a decade on Wednesday nights? I know shame and guilt it can be a huge factor for a lot of people to never want to shed light on the issue and problem.
It is. It's the number one issue. And again, I'm going to go back to me. I was very blessed. I had a family and myself that didn't care who knew. Everybody knew anyway. Okay, these parents that think that nobody knows that their kid is, quote, an addict. Well, I got news for you. Okay, when they've dropped 40 pounds, when they can't hold a sentence, when they can't sleep, all the symptoms that go with it. Yeah, everybody knows, but they still don't think that they do. And so I've seen parents absolutely bury their heads in the sand over this thing. I mean, absolute. And to a certain degree, you can't blame them. They feel that shame and that guilt that as parents, they're the ones that made the mistake. They're the ones that didn't see it early enough. And I tried to explain to them, and again, it's been 16 years of doing this, that it's not your fault, short of sexually abusing your child or beating your child. You know, everybody's got their reasons why they use. Some have medical reasons. Some have just an inquiring mind wants to know. At 15 and 16 years of age, that was kind of me and the medical thing. Fine, but these parents need to realize, and it takes time. It does. It takes a vast amount of time for them to understand that their kid needs some help. That this is, who cares what everybody else thinks? I mean, seriously, who cares? If that kid, if that child, if that loved one, whoever it is, can get the help that they need, then more power to them. But as all parents early on, they believe that this is a 30-day program. This is what's going to fix it. After the 30 days, they're done and they're going to go about their lives. And that is simply not the case.
Yeah. Yeah, I know for me, the transformation that had become the gift was understanding that the things I felt shame and guilt about would become stuff that I would be honored and get to serve and help others with. And I think that the sooner you can get to that point, and something that has always stuck with me, and I never heard it put this way till you said it, was when you talk about forget what everyone else thinks, it's like, do you want to have that picture over the fireplace or on the piano in the living room where it's your child and that's only as old as they ever get? Or do you want to see them where they get married, have kids, get a thriving career? All of these things are open to so many people we know, including ourselves, through our recovery process and no longer living in addiction. Now, we could go back to it by choice, but we no longer live in it. So with that said, I think it's important, you do a lot with the parent meetings, really helping people in a family unit understand their loved ones. So that begs me to want to ask, what are some of the important things that you do in those meetings to really reinforce to the family members, the loved ones of this, the suffering addict or the new to recovery addict, to help them understand to drop their own shame or guilt around it? Because it's a little bit different for them than the addict.
Yeah, it is. Well, again, I'm going to go back to what you just said a few minutes ago. That is such a powerful story that I tell when their child who is an addict and they have happened to pass away, and I look at the family and I say, imagine 2 years from now, 3 years from now, that picture presently that you have on the piano or on the wall, wherever you keep it, of your child at his, in his sophomore year in high school or his senior year in high school. And now it's 2 years later after your son has passed, and you look at that picture and it's still the same. And that picture never changes. It's the last picture you have. And as the years go on, you're going to get older. The pictures around that child's photograph is going to change. Everybody's going to get older. Weddings, births, funerals, blah, blah, blah. But your child remains as a senior in high school. And so that is probably as powerful a statement that I can make to any of those families. And so I have to say, I will revisit that statement time after time after time, because anything in addiction is repetitive. It's repetitive. If you don't continue to say those things, then it goes right over people's heads, and they can't imagine it unless they continue to hear it. And I know that sounds a little steep and it sounds a little tough, but this is a tough situation that we're in. This is not rainbows and butterflies. This is real life stuff, and death happens in this. So, you know, that's a huge part of it. And any type of truth that I say in these meetings, sometimes people don't like it, and again, it's always said with love and compassion and some firmness, you know, but they need to hear it. They definitely need to hear it, because I can't tell you how many people I've met with over the years that have at some point lost their child because they just didn't listen to it.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect, in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com. How have you seen those individuals that have been supportive of pain show up at the support meetings, speak with other families, maybe their children are going through it or getting on the other side of their addiction issues, and sharing openly about it, help them drop some of that shame and guilt and realize most of that's just internal bull anyways, that we need to get on the other side. I mean, there has to be some transformative stories for not just the individual who's been sick and suffering, but the family as well to begin to thrive.
It is amazing how many stories I hear on Wednesday nights from people that have been coming for, a year, 4 years, 5 years, 8 years. The 10-year people, they show up occasionally, just to get kind of a restart. But it's so interesting to see these parents. We have one set of parents, for example, that they always bring a book, okay, for the new person that comes that they want to read. They're always giving out their telephone number, and saying, look, we've been through this, and yes, you're the new person tonight, so you're going to get picked on a little bit. And I was once there, and I walked out going, I'm never going back, okay, because Flindt kind of let me have it a little bit. And lo and behold, again, it's just everything we do. Their kids are doing great. Even kids that have had 5 years, 4 years, 6 years of heavy addiction. We've got one young man now that was so addicted to methamphetamine, and methamphetamine you very seldom come back from.
Yeah.
This kid's back. He's got a year. Okay. And he's got a job, and he's taking care of his child, and he's donating help to the family, financially, so he can live there. I mean, it's just wonderful news. So we do have lots of parents that do give their support to others that are showing up.
Yeah, absolutely. I'm going to ask you to put on your other hat that you wear. I want to know from a professional lens, as a treatment provider with New Perceptions North, the treatment facility that you own in Hanford. How have you continue to approach as an organization, especially helping the families come in and dismantling that stigma when a family member comes in, and helping them understand the importance of the structure that does get put in place?
Look, sometimes it's difficult, and I'm going to tell you why. Because we just don't get clients in from the Valley, right? We get patients in from other states in the country. And like all parents, again, and I'm on their side. I get this. Okay, I don't agree with it, but I get it. one of the first things our staff lets them know is that we've got Payne and Flindt doing a Wednesday night support group for you guys, just not for your child that's in treatment, but afterwards as well as they're going through outpatient. So I have to say at this point, about 70% of those parents are going to give it a shot for a little bit and then they fade away fairly quick.
Mm.
Because again, it goes back to, oh, well, I either already know this or I don't want my face on because, the out-of-towners have to zoom in. I don't want my face on the screen, which they can black out, if they want. And so they just don't, they're just not in 100% on this thing, and so we do see some relapse because of it. And again, I don't want to say it's because of the parent, okay? Because again, we always kind of have that choice, but there's a role there,
Yeah.
okay, that parent plays, because they don't say, hey, okay, you need to go to outpatient, you need to do this, you need to see a counselor at least for the first year, minimum for the first year. We would prefer longer than that and reduce it down, of course. But it's as a treatment center, it gets a little frustrating because these kids do so well when they're there, and they look good and they feel good. And again, I mean, I know we'll get to it at some point, but we've got this new thing, okay, that's letting us know how they really feel.
Yeah.
And how and what their head is truly like and what's going on inside of their bodies. Because a lot of times, and again, me as a recovering addict, I did the same thing when I was in treatment, especially my last time. Doctor said, how you feeling? I go, fine.
Right.
Well, I didn't, I didn't realize another kid told me this. He said, I thought my anxiety was feeling normal.
Yeah.
When the anxiety is not normal.
Yeah.
Yeah. And so now we know that prior to the client even telling us they've got anxiety. So we got some good stuff coming up here that's going to help folks.
Yeah, I want to touch on that in a second, but I want to mirror what you just said because I didn't know I had an anxiety disorder until I got sober and a doctor was like, "Yeah, what you're feeling sounds a lot like anxiety." Huh? What? Me? Really? Yeah, and it was to the point of there were a few panic attacks in there,
Sure.
but yeah, not everybody knows that that's what it is and how to communicate it. So, you are incorporating just amazing technology. Why don't you touch on Opiate?
Sure. Opiate is it's a company that's been around for 10 years, and they've well finished their clinical trials. We're just months away from FDA approval, and it is a smart AI watch that has no markings on the watch whatsoever. It doesn't have opiate. It doesn't have Samsung. It doesn't have anything like that. And this is more than just a Fitbit. In fact, it's 1,000 times more than a Fitbit. This is going to tell our staff, our techs, our nurses, our doctors, and it goes to the doctor. It's going to say that this is their anxiety level, this is their depression level, this is their sleep patterns, this is how much they slept last night. Even if they're telling you they slept for 8 hours, they only slept for 4.5. It's going to tell where they're at as far as relapse is concerned. It does many things that again, for the lack of a better term, is going to take out the human error, if there is any, when it comes to checking on clients and doing that. And that watch is worn through detox, residential, and outpatient. So it is, again, it's Dino Miliotis is our partner in this. Dino's the largest investor in Opiate, and he's a wonderful human being, wonderful man who brought us in. New Perceptions were the first to use it. Now we're going out and we're getting it into other treatment centers across the country, because this is a step, and I do believe this. If we can get to that internal mess that's going on inside of somebody, instead of waiting and hoping that they're going to tell us the truth in this, then we are miles ahead with this thing. Their medication can be adjusted. Everything can be adjusted to help them, and it gets to our doctors in 5 minutes. It's unbelievable how this works. So it's new technology. I think that for so many years we have, again, we going way back, we've done the advocacy work, we've done all that, but people are looking for solutions and answers to this turmoil that we're in, and this is it. So the next step, of course, is to change the insurance company, so we make sure the insurance companies are going to take this and they're going to be able to pay for this watch, because we're already working with some governmental aids, governmental contracts, but we have to do that. And just real quick, you know, when you've got the doctor sitting on the other side with the insurance company who doesn't know shit about that patient and that client that we're dealing with, and says, oh, that opioid client only needs 4 days of detox, and we're going, whoa, wait a minute, no, he needs at least 10 days, obviously more than that, but we have to do this in pieces with the insurance company. That now, because of this technology, our doctors can go back and say, hey, doc, to the insurance doctor, wait a second, you're wrong. Mm-hmm. Okay. This is what is going to help this client. And this is, by the way, Mr. Insurance Doctor, this is what is going to help you guys save money in the end.
Yeah.
You know, so that's where we're at with this thing. We got some big stuff coming up in July to let everybody know about it.
So Flindt, if there is someone that's listening and they work at a treatment facility, have a treatment facility, and they're interested in opiate, who should they contact? What's maybe a phone number?
Yeah, they can contact Dino Miliotis at 910-777-4915. That's 910-777-4915. He will answer any question. Of course, you can contact me at 559-978-9239. Yeah.
All right. Well, that's in the podcast description. Let's close it up with this. Flindt, I want to ask if there's someone who's listening or they have a loved one who might be, they know that recovery journey needs to start and they're still feeling some of that shame or being afraid of being judged. What would you want them to understand and know today?
Wow, that's a loaded question, my friend.
Well, give me the Cliff Notes version.
I'll give you the Cliff Notes. First of all, you have to make a decision. Do you want life or do you want death? That's what it comes down to. Because remember that short of being a fentanyl addict, addiction can last a long, long time. And you are basically a walking dead person during that time. That was me, so you have to make that choice between life and death. And the shame, the guilt, everything that goes with it, I guarantee you that's going to go away at some point. Okay. If you do what you need to do. We've all had it. I think that's kind of gets lost somewhere with everybody, especially talking to a new person that, hey, I did that and I did this and I did that and I did blah, blah, blah. Right. So that guilt and shame starts to go away. And in fact, I love recovering addicts. I mean, they are some of the best people I know. They're kind, they're polite. That doesn't mean you don't have a temper. That doesn't mean that doesn't mean you don't get loud sometimes. That doesn't mean you don't, but your heart is good and your soul is good. And there's nothing quite like sobriety, to be honest with you, even though life's not easy, but it works. It works. And some of those old AA sayings actually do work. Yeah.
Yes, sir. Yes, sir. Well, thank you, Mr. Andersen, and thank you for listening or watching Pains Don't Hide the Scars. Of course, Apple Podcasts, Spotify. Give us a follow there and leave us a rating, review, or go to our YouTube channel. That's youtube.com/@PainNonprofit. Hit that subscribe button, please. Leave a comment and share this with someone else that you know would get value out of it.